listeners, you found Sanctuary's YouTube channel where we post lots of educational chats with women who are educators, artists, nonprofit leaders, and specialists in their different fields and industries. I'm Myrna Haskell. I am the executive editor of Sanctuary Magazine. This is an online publication for women that empowers and inspires with a focus on the arts, philanthropy, wellness, inspirational travel, career, and finance. You can find us at sanctuary-magazine.com. Now, some of you may recognize this gal who's with me today, Dr. Sherry Kelly. She is a psychologist, a sought-after keynote speaker for symposiums on various educational topics, and she's also the founder of Mind and Heart Coaching. Good morning, Sherry.
Good morning, Myrna. It's great to be back with you.
I know. I love doing this with you. You're a wealth of knowledge on so many different topics. And of course, it's November, and so it's our Aging Gracefully issue. And so the topics of Alzheimer's is something that affects so many people. I think everybody, almost everybody I talk to has a family member or a friend who suffered with either dementia or has actually gotten Alzheimer's. So we have a two-part all about Alzheimer's. This is part one. And I wanted to start the whole thing out though, Sherry, by asking you the difference between dementia and Alzheimer's, the disease. What is that difference in case some folks don't realize?
That's a great question. Simply stated, Alzheimer's is one of the dementias that people suffer from in aging. So it's a type of dementia. There are several types of dementia. The common ones you may also hear about, in addition to Alzheimer's: vascular dementia, Lewy bodies dementia, there are frontotemporal dementias. So there's different types of dementias. And that's a really important question to ask your caregiver, physician, nurse practitioner when you're concerned about dementias, because it could be a different type of dementia. Alzheimer's is one that we commonly use, and we just sort of throw everything into this one label of Alzheimer's, when it really could be a different type of dementia that has a different prognosis, sometimes a different cause. So it's important to make that distinction with your healthcare provider.
Is Alzheimer's more serious? Like if you are actually diagnosed with Alzheimer's, I guess maybe what I mean by more serious is there more of a swift decline? Is there more of, because I think I've heard that even some of the bodily functions, when it gets to a real advanced part of the disease, stop functioning the way they used to. Are other dementias also doing that, or is that why Alzheimer's is so much in the press and everybody's talking about it, because it is a scary type of dementia?
I think Alzheimer's is more common, and that's why it's talked about more.
Okay.
Between Alzheimer's disease and vascular dementia, those two dementias really, I think, sum up to be about 90% of the dementias that are most commonly diagnosed in America.
Okay.
Those two.
Okay.
And there's, in my experience, having been a neuropsychology fellow and trained in neuropsychology as well, when I was doing assessments with patients with dementia, my professional experience was that frontotemporal dementias seem to have a very sharp decline and seem to have affected younger populations than the Alzheimer's. Although there is something called early onset Alzheimer's. But
yes, I've heard of that.
My experience has been with frontotemporal dementias. Some of those folks that I was testing were as young as in their mid-50s. So it very much depends on the type of dementia and also what leads up to it. Vascular dementia is something that's unfortunately way too common, and it relates to cardiovascular disease.
Oh boy. Okay. All right. Thank you for that. So you had told me before we came on today that there's some new research I do receive information from the Alzheimer's Research Association and a bunch of other things, but I want to hear from you, Sherry. What's the stuff out there that you've been looking at, and what do you think listeners will be interested in there with the research that's happening?
Well, I think, okay, I'm going to start with the first question that people ask me about Alzheimer's research. And the first question that I'm asked is Alzheimer's, a normal part of aging, and what does research show about that? And, isn't it just aging? And the answer is no. Okay, Alzheimer's disease is not a normal part of aging.
Okay.
And I don't know how people feel about that when they're being told that, but some people might take comfort in that. Other people might be afraid about that.
Right.
You have to examine how you feel about that. But I think what research has shown us over the past 3 decades is that no, it's not a normal. And something really serious changes in your brain. And your brain actually recedes. And I will be showing you a slide later that has a picture of a normal brain and one that is Alzheimer's. Okay, so what research is really looking at are areas such as the following: causation, okay, what causes it, what gives you a greater propensity to get it, okay, and then they're also looking at prevention, right? And then what to do to slow the progression. So those are the key areas of research. Okay, so keep in mind that one of the things that happens with Alzheimer's disease is that you get nerve cell death, okay? And this is caused by this progressive degenerative disorder linked to buildup of proteins in the brain. Okay, so they're looking at what causes the buildup of these fats, and we call them plaques and tangles in the brain, okay? And these proteins. So they're looking at beta amyloid, and they're looking at tau. Tau are the tangles, and the beta amyloid is what's associated with the plaques, okay? So tau for tangles, okay? So one of the things that has been going on for at least 25 years, because when I was a fellow at New York Hospital, Cornell, there was research going on between the folks at Cornell and Rockefeller at the time on looking at beta amyloid blockers. And this is something that was also going on 25 plus years ago with researchers in France. So this still is a very big area of research. So how do we block those plaques and tangles from happening? Okay. The other area, as I said, is genetics research. What's your propensity? What's the loading? And then is it multifactorial? Well, we know sometimes it is. Is it just genes, or is it something on top of that? Is it your lifestyle? Is it a history of traumatic brain injury? What on top of the genetics is going to make you more likely to get it? Okay. So those are some of the areas that you're really looking at. The other area of really interesting research has to do with, well, how do we help the brain stay healthier so those plaques and tangles don't attach? And this is an interesting area of research. It's also through the French and through also the Technion University in Israel. And they're looking at what might help dissolve or prevent those plaques from attaching and staying there. And they're looking at the role of different molecules, and they're looking at chelation to sort of like try to get rid of the molecules or prevent the molecules from sticking.
Okay.
So those are sort of the key things. Okay.
What about,
And
I wanted to talk a little bit about, because I know we have a lot to cover, even though we are doing it in two parts, but besides the research, are they getting anywhere with diagnosis? They're able
yeah,
to do that? They are?
yeah,
Okay.
yeah. So one of the things I want to talk about with research and diagnosis, in addition to the plaques and tangles, is something that's seen in Alzheimer's dementia, which is reduced acetylcholine signaling. And that's one of the, in the brain. So that's one of the things that researchers look at and diagnosticians look at, is your brain signals talking to each other. And they look at how the brain's actually functioning.
Okay. Wow.
So when we go to, yeah, I mean, there's a really, and I'm going to get to some treatments later on, but this is like really, exciting stuff. So when we're talking about, when I give talks, oftentimes, people will ask me, well, am I losing, am I going crazy, or is this dementia, or am I losing my mind? Literally, am I going crazy? Okay. So do you want to go over some important warning signs?
Yes, certainly, because I think sometimes you may think it's a dementia thing, right? But it's a simple forgetfulness in later life, right? So yeah,
Right.
I'm sure listeners want to hear about that. Absolutely.
Yes. And when I was testing in New York, when I did a lot of my work, it was, is it depression, or am I suffering from cognitive decline? Am I just, tired? Do I lose focus, or is it something more serious? So here's some big warning signs, okay?
Okay.
The first area we look at is executive functioning. So that has to do with the frontal part of your brain, like executive functioning, because we think, well, that's what executives do. That's an easy way to remember it. Okay. Planning, initiation, short-term memory, attention, keeping your focus, being able to do two things at once, being able to hold something in your head and do something else, okay? Being able to retrieve information quickly, that recall, oh, I can't think of that name, that kind of stuff, okay? Right. Memory lapses and memory losses. So, is it a brief lapse in memory, or are you totally blanking on it? Lack of interest and apathy, really important.
Okay.
That is a huge red flag. When you start losing your interest in socializing, in doing activities and exercising and seeing your family, things you may have been interested in, you've lost it. You have apathy. And that's something that the research shows very clearly as a warning sign. Changes in sleep patterns, which a lot of us have as we age, but when it's getting really serious. So when you're unable to sleep at night, or when you wake up at 3 and you can't get back to sleep.
Wow.
And let's say you start spending most of your day sleeping.
Yeah, that's not good.
So that's when you really need to address it with a healthcare professional.
Okay.
Speaking and not speaking. So what you see in a lot of people with Alzheimer's is, and this is, later on, they stop conversing. And I think this is sort of twofold. One is that they don't have the passion for keeping the conversation going. They're not interested. They're not keeping track of the flow of the conversation. They may have a hard time finding the words. The other thing I have found is that some people ignore having a conversation or become very silent because they don't want to be found out.
Okay. So in the beginning stages, then it's probably part of the depression too, is the person's realizing their cognitive decline. They don't want others to know because they're scared.
They're being very careful.
Okay.
And protective.
Okay.
Now,
and so are they using these signs, Sherry, these different warning signs that they found out? Is that part of the diagnosis then, these different behavioral changes that they look at besides something else?
Yes. It's collective when they're looking. It's a holistic. They also look at problems with planning and initiation. For example, they're not keeping track of their finances. They haven't updated their insurance, or they've let things lapse. They haven't done taxes. Low frustration tolerance. losing your temper, personality changes,
Personality changes. I've heard of that too. Yeah.
getting lost when driving, things like that that are really important. Blaming others for their lapses.
Okay.
You know, so this and time confusion. So as well as changes in mood. So these are the things that lead to diagnosis because number one, it leads people or their family members to send their loved ones to get evaluated.
Okay.
Okay.
Now there's not a blood, is there a blood test? Like, is there an
They're looking
actual?
look for biomarkers. They
Okay.
look for biomarkers. They look for buildup of proteins in the blood. There's now research that's going to come out, which is really interesting. Non-invasive research such as retinal scans.
Oh, okay. That's interesting.
Yes, and somebody I know is also working on another non-invasive approach that involves saliva. So this is, you know, all really cool stuff.
Yeah.
The other way that it's diagnosed, I just want to show you this, is it's really a comprehensive approach from that you can get with a neuropsych evaluation, sometimes biomarkers, sometimes genetic testing, and also sometimes neuroimaging, and neuroimaging will show the brain degeneration.
Oh, okay. So yeah.
Right? So the neuropsych eval, which is what I do and what I've done a lot, it involves really a walk around the brain where you're looking at the executive functioning up here, you're looking at memory, you're looking at problem solving, verbal abilities, word retrieval, your ability to plan, initiate, organize, visually organize information that you hear. So it's really a mental status exam, but very deep into all these different areas of cognition, as well as emotional functioning.
Okay. That's a big piece. That's a big piece.
And the information that clinicians get from family members is really important because then you're able to get objective information about, well, how much has this loved one changed over the years?
Okay.
You know, in terms of all of these things. Okay.
I see.
So that's okay. And there's something that is really important I want to share is to get evaluated early, because what research has found is that if you're identified early with mild cognitive impairment, there are lifestyle changes and medications like Aricept is one that's been out there for a long time that you can start. The problem is that people are referred too late.
Okay, that's a big problem then, because then there's already been the decline and they can't, you know, start something up nice. I've heard of people getting it or being diagnosed in their late 40s and 50s. So that's pretty scary when that happens and they're diagnosed early like that, the early onset Alzheimer's. Is it usually a more severe case because they are diagnosed so young, or what are the statistics?
It can be, and that again is when it's really important to figure out, well, what's the genesis of this and what's the differential diagnosis? Is it Alzheimer's? Is it frontotemporal dementia? Is it another type of dementia? Is it, you know, dementia related to, you know, multiple concussions or head trauma? So it really depends.
Okay.
But you know, the thing that we want to stress is that there are preventative measures that you can take as well. And that when you have a diagnosis early, that there's a chance for you to change your lifestyle, get pharmaceutical approaches to try to keep yourself more vibrant through your life.
Oh, that's wonderful. And actually, we're going to do a whole spot on that prevention thing next time around, right? So listeners, remember, Dr. Sherry's going to come back in January and we're going to talk about specifics in prevention and what you can do with lifestyle changes. So that's going to be in part 2. But are there other things you want to, is there anything else, Sherry, for this part 1 that you want to discuss before we head out?
No, I want to discuss. So, what's the problem, and why do we have a delay in diagnosis? Okay. And I want to talk about that because it's not helping your loved one to be in denial.
That's right.
And I'm not self-promoting because I don't do these evaluations anymore, but I just wanted to share with your viewers and listeners. Delay in diagnosis is a problem because it's keeping your loved one from getting the help that they need and preventing further or faster decline. Okay. So don't be afraid. There's fear. And so explore those fears. What's the worst that can happen? Are you afraid of making your loved one upset?
Okay.
Okay. Is this, a gradual initial decline that you're kind of not wanting to recognize? Because it's a gradual initial decline. And what I like to think of Alzheimer's as a flickering light bulb. It's not falling off of a cliff. It's like a flickering light bulb. And yes, you're going to have a loved one with moments of greater lucidity, and then some moments that are going to be more severe. So it's difficult because it's not progressive in a stepwise fashion.
Yeah, I can see that being a big problem though. People, and I think probably fear itself with the person who thinks maybe their recall and these different cognitive functions are declining. They don't really want to hear. They want to dig their head in the sand maybe too, besides even the fact that maybe they don't want to make their family nervous as well, right?
Correct.
So people need to know, get diagnosed, get checked if you're seeing something.
Early. And, people, I had a parent with Alzheimer's and she lived for 15 years past diagnosis.
Yes. And my grandmother had it as well. Yeah, I know. Almost everybody you talk to, people are living longer now too.
They're living longer with it. So, so the earlier you're diagnosed, the more you can address it head on and get help. And oftentimes what I see is that drugs are prescribed too late. Okay. And I think, what I'm going to close with, or I'm going to just share with you is this. In our next session in January, I'm going to talk more about, well, what do you do? How do you prevent it? And what do you do once you have this diagnosis?
That's going to be invaluable. Thank you so much for that.
But yes, but in the meanwhile, I want you to think about something with your loved ones and with yourself. I want you to think about, and not be afraid. I want you to think about expectations and what your expectations are for your loved ones as they age, and what your expectations are for yourself, not only as you age, but as you want to support them as they age. Okay. And it's interesting to have this, to start having these conversations early. Mom and dad might expect to be, living independently the rest of their life. That's their expectation. And well, how do you get there? And what do you have to do now, when you're middle-aged or a young senior, or I like to call people legends. Oh,
I love that, Sherry. Legends. Yes. That's so much more positive, right?
What do you have to do now? Okay. And that's a realistic approach, not a dream on approach. What do we need to put in place now? What do we have to do in terms of our health care? What should I be asking the doctor about? Okay. So start there. Start thinking about what your elder years are going to look like then. And your expectations for your elderly loved ones. Okay. And what their expectations are. Are they realistic or not? Okay. And that's actually really important in determining how grounded they are cognitively. Okay. Are they realistic or not? That's a tough one. I think lots of times, yeah. And it's fear. It's about fear probably too, though, right? If you're admitting you probably can't stay in your home or you can't do this or that, you feel defeated. And also you lose control. Right. And these are really big fears that people have. And too often loved ones get in trouble because someone didn't take the car keys away,
Right.
or someone didn't organize their medication, you know.
And I think we're going to get a little bit into the piece next time around too, so listeners know about how to approach our elderly loved ones if we think there is an issue, how to talk to them besides prevention tips, right? We're going to do both of those things next time.
Absolutely.
Okay, because that's really important too, Sherry, I think. Yeah. I'm so happy that you decided to do this with me because, you know, people they don't have time to read about it. They're not sure about it. They're afraid to learn about it. They're hoping maybe that their memory lapses or their decline is hormonal related, right? Whatever the situation is, I think having knowledge, having what you need to understand and learn about this disease early, as you said, is imperative, right?
There's hope. So there are so many exciting clinical trials going on right now. Amazing clinical trials. And if your viewers are interested, they can go on to clinicaltrials.org and learn about it. There's a clinical trial going on in Boston. I'm going to talk more about that in our next session to get you interested. Oh my gosh. There is a trial going on for a nasal treatment.
Wow. Okay.
Yep. Okay. And you can, this is at Brigham Hospital in Boston. And so you're going to, there's treatments for helping people who have memory loss with the brain cloud interface going on. Again, in Israel, they're looking at also science fiction sounding stuff like implantable chips.
Okay. Yeah. That gets scary in itself, right? But hey.
The research is out there. Okay. And I think the more knowledge you have, the more comforted you're going to feel.
Absolutely. Well, thank you so much for being with me this morning, Sherry. And I know my listeners are starting to get to know you because you're a regular member of our community now. You've been with me on different various interview shows. You've contributed through articles in the magazine. So I really, really appreciate it. And as just a reminder, part 2 will be in January. It will be announced in our newsletter. But I'll close as I always do by wishing all of our listeners and our readers good health, happiness, and continued inspiration. Have a wonderful day.
Thank you.